Drive far enough into Northern California, past the dense cities, and the landscape opens up into vast, isolated stretches of highway. Out here, the quiet masks a severe problem. Shasta County has officially declared a public health crisis for 2025. The region is dealing with an acute shortage of primary care physicians, OBGYNs, and psychiatrists, leaving families with fewer options for basic medical care. This video is brought to you by Shasta Unfiltered, a local news outlet investigating these regional challenges. Read their full reporting at shastaunfiltered.com. To address this doctor shortage, the Rural Northern California Medical Education Consortium has proposed an intervention, building a medical school right here in Redding, anchored at Simpson University. But building these new medical facilities requires immense capital. The question remains how a rural county could realistically manage that kind of investment without burdening its residents. But there is a precedent. In the early 1990s, eastern Kentucky faced the exact same reality. Pike County was one of the poorest and most medically underserved areas in Appalachia. The primary care doctors who were there were retiring, and new graduates weren't moving to rural towns to replace them. Local leaders spent years planning a response. In 1997, they opened the University of Pikeville's School of Osteopathic Medicine, enrolling a first class of 60 students. The history of that Appalachian project shows how these specific geographic and financial hurdles were cleared. Pikeville succeeded because they built their medical program inside an existing institution, Pikeville College, operating since 1889. By partnering with the college, the medical school immediately gained an established campus, administrative infrastructure, science labs, and a faculty roster. The hardest parts of starting a university were already finished. Simpson University offers those same advantages today. They already have regional accreditation, established pre-med and biology tracks, and a rapidly expanding nursing program. Adding a medical school to an existing private Christian university bypasses the need to build a campus from the ground up, lowering the initial barriers and the upfront infrastructure costs. Even with an existing campus, expanding a medical school requires capital. When Pikeville needed to build their state-of-the-art coal building, it cost over $47 million. Naturally, people ask who pays for that. Out of the $47 million, $36.8 million came from federal New Markets tax credits, $26.5 million from a USDA loan, and $1.5 million in college equity. Noticeably missing, 0 local taxpayer dollars were used for construction or operations. Some have questioned if a private faith-based school like Simpson can access these federal funds. Pikeville is also a private Christian college. They qualified by adhering to a standard legal requirement, ensuring that the federally funded classrooms, labs, and clinics remain strictly secular in their daily use. Structured as a public-private partnership, they imported federal and private dollars to build the facility, removing the tax burden from the local community. The clinical results show the impact. Since its founding, the Kentucky Medical School has produced over 2,200 alumni. More importantly, over 60% of those graduates stayed to practice in underserved rural and Appalachian communities. The local economy saw gains as well. The campus expansion created 260 direct construction jobs, and the school now supports 64 permanent high-wage roles. This map projects those same outcomes onto the 17-county North State region. A local medical school would generate an estimated $10 to $15 million in annual student spending, creating a regional economic ripple effect over $100 million across the next decade. The logic is straightforward. Doctors tend to put down roots where they train. Training health professionals locally is a reliable method for ensuring they stay and practice in the communities that need them most. This model addresses the shortage of physicians while supporting local high-wage employment and millions in annual regional spending. The decision now sits with Shasta County leaders, Simpson University, and the surrounding community. Should Shasta County build its own medical school? The data from Kentucky indicates the answer is yes. By leveraging existing local assets and tapping into dedicated outside funding, a rural region can solve its own medical shortage. If you want to follow the latest developments with the Rural Northern California Medical Education Consortium, hit the like button, subscribe to the channel, and visit shastaunfiltered.com.